Very brief, so I'll speak a little bit about sorry, don't. So I'll speak about some of the technologies that our lab can offer now, and I was very fortunate to be able to work with Bob for several years, and some of these projects that I'm going to show are based on the work that we've done in Bob's lab. And we're going to talk a little bit about the heart and myocardial infarction. And before speaking about the technologies, I would like to say a few words about the disease that we're trying to cure. So myocardial infarction or heart attack, it's an irreversible progressive damage disease, and it happens when a major blood vessel that nourishes the left ventricle is blocked, and as a consequence the cells in this area are dying. These are cardiac cells, cardiac muscle cells, the contracting cells of the heart. They die since they cannot proliferate, and since we do not have enough stem cells in the heart. This whole area becomes fibrotic and a scar tissue, and the heart cannot send pulses of blood and oxygen to the rest of the body. And basically the poor statistic says that 50% of people who've had their first heart attack will die within 5 years. So the only solution these days is heart transplantation, and since we know that there's a shortage in donors, there's a need to find new experimental approaches to try to repopulate this area with cells that are able to contract. So I will tell you a little bit about cardiac tissue engineering and the work that we're doing in our lab. So what is tissue engineering in general? So in tissue engineering, we can take cells from the patient or any other source, as I'll mention soon. We can cultivate them in a two-dimensional flask, and then what we do, we take the cells, we seed them in three-dimensional biomaterials that we engineer. We can incorporate different growth factors, different molecules or nanoparticles, and basically what we want to achieve is to have to let the cells organize into a functional tissue. Once the tissue is organized, we can take back the tissue that we engineered in the lab and transplant it to the patient to regain function of the defected tissue. And this is one of the early examples in tissue engineering. This was done in Bob's lab at MIT in the early 90s, I think. So you can see a biomaterial here in ear-shaped, and it was seeded with the chondrocytes, cartilage cells, and transplanted on the back of this mouse. And the purpose was not to try to help this mouse to hear from the back, but rather to show that the tissue can integrate nicely with the host. So how do we construct or engineer the cardiac patches? Basically, we can use different cell types. We can use adult cells from biopsies, human embryonic stem cells, or adult stem cells such as mesenchymal or cardiac stem cells. We manipulate these cells, and then we seed them in the three-dimensional biomaterial. And then we can transplant it on the heart, and we've already shown that once we do that in animals that have gone heart attacks, we're able to improve heart function in a significant way. And after transplantation, the biomaterial degrades, and we've left only with the engineered tissue. But there are a few challenges in the biomaterial field of tissue engineering, and one of the challenges is how to recapitulate the extracellular matrix, how to create a biomaterial that will give signals to the cells to force them to organize into a functioning tissue. And here in this slide, what you can see is the extracellular matrix of heart. So Sharon Fleischer from my lab took hearts from rats, and she manipulated these tissues to remove all the cells from the tissue, and we've let we've left only with the extracellular matrix. And as you can see, it is filled with different kinds of fibers, microfibers, nanofibers. The fibers are oriented or not. They are coiled or straight. And we first went to evaluate what's the role of these fibers in the assembly of cardiac tissues. So Sharon now knows how to create fibers in the lab with different synthetic technologies. So she can make micro-sized fibers or nano-sized fibers. And she first looked at I hope that you can see it, but I'll tell you what's going on here. So she looked how cells react to these fibers. And when she cultured the cells on the micro size, the cells are rounded. When she cultures the cells on the nano size, the cells are more elongated and more aligned, more as if like they should look in the native tissue. Sharon can also make fibers that are randomly oriented or parallel. And when we grow cells on these fibers, the cells either grow randomly or they can be aligned. And also we can try to recapitulate or to see other fibers in the extracellular matrix, such as cold fibers, and to synthetically create these fibers. So now we have fibers that are coiled fibers. They are spring-like fibers. They can interact with the cells, and when the cells contract or relax, they can do the same without stressing the cells. And we see that scaffolds, three-dimensional scaffolds from coiled fibers can basically promote a better contraction of the cardiac patch that we're engineering. And here you will see a movie of such patch that we engineer in the lab. So this is spontaneous contraction. You can see that we've engineered a patch that nicely contracts for 2 weeks without external stimulation. And now we can take this patch and transplant it on the infarcted heart to improve its function. Another problem that we have is that the biomaterials that we're using, sometimes they're not really biocompatible. Sometimes they trigger an immunogenic response. So without disclosing too much, I see that people from Ramot are here. So without disclosing so much, I will say that we were able to create some biomaterials that are based on the patient's own molecules. So now if we take cells from the person using these biomaterials, we have a completely autologous patch that can be transplanted without affecting an immune response from the patient. And we're engineered tissues. We could see that the cells organized really nicely on these biomaterials. And another important thing in these biomaterials that we want them to be able to promote the organization of endothelial cells into a blood vessel network, because after transplantation, we don't want the cells to die within. So we were able to engineer blood vessels in the engineered heart tissues, and now it's really ready for transplantation. Another problem that we have and we were trying to solve is the electrical activity of the cells when we culture cells in the three-dimensional biomaterials. They contract in different places, but nothing is really synchronously contracting. And Michal Schumann, who received the Gertner Fellowship last year, is working on this project, which I will show you in a few seconds. But basically, what we were able to show that if we take nanowires, gold nanowires that are conducting, we can improve the connection between cardiac cells and propagate more anisotropic electrical signal in the cardiac patch. We synthesized these nanowires. We incorporated them in three-dimensional scaffolds, and we're able to show that a patch is contracting nicely inside the cells are contracting nicely in the biomaterial. And with the help of Ben Maoz from chemistry, Michal also she evaporated gold on these small or tiny nano fibers. You can see the gold particles here. And we're able to first improve the function of the tissue, but more important, and this is new, and we hope that we'll be able to have more data about it. These gold nanoparticles have reflectance, and basically if we take antibodies and we conjugate to the gold, these can serve as sensors. So after cells secrete different molecules, these particles can sense it, change their reflectance, and we have sensors in an engineered tissue. So this is just some quantification of the data. Just to show you, I want to show you the last thing is that the cells in the biomaterial with the gold contracts nicer than regular scaffolds. The last project that I'm showing now with the Cyborg tissues, we're integrating nanoelectronic devices with three-dimensional biomaterials to have these nice scaffolds with tiny sensors within. When we're culturing cells, these three-dimensional biomaterials can record the function of the cells, and when we add drugs, they can immediately sense that. You can see it here. And now we're working on the next generation of cyborg tissue. This is work of Ron Feiner and Leah Engel. So we're working on transplantable cyborg tissues that are flexible. We would like them to be wireless. We want to incorporate control-release system in these cyborg tissues. So basically, what we want to achieve is to have a patch that can improve heart function on one end, and it can stimulate the heart, work like a pacemaker if you want, and record the function of the heart. And upon whenever we want, we can basically release drugs in certain spots on the heart to improve the function of the heart. So with that, I will finish up, just thanking my lab members, collaborators, and the funding. So thank you.
So, at this point, we're finished with the scientific part. And just one comment, you've seen a lot of images and a lot of pictures, and there's a lot of equipment and a lot of laboratories and a lot of people, of course, that are involved in generating all this data. So if you're interested and want to see how does it look like, all of you are most welcome to come and visit the labs. And again, all Sunday will be available, but in between, and if you have time, let us know and we'll be happy to host you. So the next speaker, I'm very happy to introduce Dr. Sylvia Neumann from Pontifex. I'm trying to do two things together, so I find it a little bit challenging. There you go. And Sylvia will be talking